Does caffeine affect sleep apnea in the elderly? Have you ever wondered if that morning cup of coffee could impact sleep apnea in older adults? It's a question worth exploring, especially for those managing this condition. Sleep apnea is a common issue among the elderly, characterized by interruptions in breathing during sleep. These interruptions can lead to fragmented sleep and increased daytime sleepiness. Now let's talk about caffeine. This popular stimulant is found in coffee, tea, soda, and many other products. It can boost alertness and may even delay sleep if consumed too close to bedtime. However, when it comes to sleep apnea in older adults, the effects of caffeine are not as clear-cut. Research shows that caffeine does not consistently worsen sleep apnea severity or sleep quality in elderly individuals. In fact, some studies suggest that moderate caffeine intake, particularly from coffee or tea, does not negatively impact sleep apnea symptoms. Interestingly, some older adults who avoided caffeine reported more sleep disturbances. While caffeinated sodas have been linked to more severe sleep-disordered breathing in certain groups, coffee and tea do not seem to have the same effect. Caffeine may even act as a respiratory stimulant, potentially reducing the severity of apnea by encouraging breathing. However, it can also increase wakefulness, which might reduce total sleep time. For elderly individuals with sleep apnea, moderate caffeine consumption earlier in the day is generally safe and unlikely to worsen symptoms. However, excessive caffeine or consuming it late in the day could disrupt sleep continuity. This is something to keep in mind for those looking to maintain good sleep hygiene. Here are some practical tips for managing caffeine intake. First, try to limit caffeine consumption in the late afternoon and evening. This can help avoid any sleep disruption. Second, pay attention to how your body responds to caffeine, as sensitivity can vary from person to person. In addition to managing caffeine, maintaining good sleep hygiene is essential. This includes creating a comfortable sleep environment, sticking to a regular sleep schedule, and following any medical treatments, like continuous positive airway pressure therapy. Always consult with healthcare providers about caffeine use as part of a broader sleep apnea management plan. In summary, caffeine does not have a clear negative effect on sleep apnea in the elderly when consumed in moderation and not too close to bedtime. Its impact can vary based on individual factors and the type of caffeinated beverage consumed.